Hello, my name is Joanne Simm, and I'm here today to tell you about the story of my father, Colin. Um, Before we start, I'd just like to add that I am a NHS matron and I've worked in NHS trusts for many years. I'd like to take you back to 2020 when COVID was around. My father, for a bit of perspective, was a 65-year-old gentleman, fit and well generally, type 1 diabetic, but independent self-care and had a good job, was doing well. Once COVID come along, as everyone may know, that all routine appointments, hospital visiting, doctor's appointments and things were all stopped to keep everyone safe, which meant everyone kept safe. However, if you had a medical condition, it was a little bit concerning because face-to-face contact was put on hold and all regular appointments were switched to telephone appointments. So given that time for a period of 2 years, my father never had any diabetic checkups, any bloods, anything like that, just all over the phone. How are you doing? Are you managing okay? Which he was absolutely fine. When the restrictions started to lift, then these face-to-face appointments come back into place. He went for his first diabetic appointment face-to-face with the nurses, and he had some bloods taken at that appointment. When results come back from those blood tests, it shows that there was some concerning factors and they wanted to refer him into the hospital for a review. So he went for his review. Unfortunately, he was diagnosed with leukemia, which came as a great shock because he didn't have any symptoms of this. However, he was under the hospital, he was seeing a consultant, and there was a plan in place. So we were fairly confident that he was going to manage, and with a little bit of treatment, he would have been well. So the plan for him was to start some oral chemotherapy, which consisted of going to outpatient appointments, having some chemotherapy, having bloods done, and going home on the same day. So this is the journey that he went down. He started his treatment on the Monday, and the plan was daily chemotherapy, and then for 2 weeks, then a break, and start again, and so forth and so forth. So it was all going well. Monday, Tuesday, Wednesday, he'd been to his appointments, he'd had his bloods done, he'd had his chemotherapy. I'd been in touch with him many times throughout the days. How are you doing? Have you got any symptoms yet? Do you want anything bringing over? And he was absolutely top of the world. No, I'm great. I don't feel any side effects. Everything's going well. And then it got to the Thursday. He went to the hospital. He had his chemotherapy. He went home. And then he rang me on the tea time and said, I have to go to A&E. The doctors have been on the phone. So what's happening? Are you feeling unwell? Or no, I'm feeling great, but my bloods, there's something wrong with my bloods. I said, okay then. So off he went to the hospital. He went there and they said that he needed some treatment for hyperkalemia. So he went there and he had the treatment and was expected to go home on the same day. However, following further blood tests in the A&E, they found he had an infection somewhere. He didn't have any symptoms of that infection, but they wanted to admit him just to keep an eye on him. So he goes and he gets admitted to the hospital. He's doing well. His blood sugars are remaining stable. He's had some treatment for his hyperkalemia, but his infection markers are still raised. So he was admitted to a haematology ward, which was great, exactly the right place where he needed to be. Spoke to him on the Friday numerous times. Everything was absolutely fine. He said he felt like a little bit of a fraud, actually. He said, I feel like there's nothing wrong with us. I'm in this hospital bed. Somebody who's poorly could be having it. I really should just come home. So I said to him, and it's something that I live to regret, don't worry, you're in the right place. They look after you. That's where you need to be. And that was that. So the next day, the Saturday morning, I gave him a call. Very, very different on the phone. I knew immediately there was something concerning. He was very confused. He couldn't string a sentence together. He kept saying the odd word, but moaning and groaning. I thought something's quite wrong. Is he having a hypo? So I managed to get in contact with the ward, explain my concerns with the ward. There's something significantly wrong. Can you go and see him? Is he having a hypo? Can you get the doctors in? I was reassured many times by the nurse and staff throughout that day that he was okay, that he just had a headache and he felt a little bit tired, so he was sleeping. things significantly changed on that Saturday. On that morning when I rang him, that was the last time I spoke to him that day. He didn't answer the phone for the rest of the day. Ringing the ward was quite challenging. Every time you rang, you very rarely got an answer. I know everyone's busy, but there was no ward clerks. There was no way of getting through. It was very frustrating. COVID restrictions were still in place within that ward because of haematology and the high risk. So you couldn't just go down and see for yourself how he was doing. So it was quite a challenging time. I'd managed to speak to the nurses a couple of times, but not a lot. But I just kept getting reassured he was fine. So then Sunday morning, same thing, rang his phone. It took 3 or 4 times for him to answer, and when he answered, his confusion was much worse than the day before. Still couldn't make anything he was saying out. He couldn't form words at this point. He was just grunting on the phone. So again, rang the ward, was very, very concerned and asked if he could have an urgent review by the medical team. This time the nurse that I'd spoke to had said he'd had a bit of an unsettled night, but the doctors were with him now. He was alert and he was orientated, but so they weren't overly concerned. The doctor rang me back and I had a long conversation with the doctor on the phone. We spoke about capacity. We spoke about the plan for him going forward. She said she was happy for him to possibly be discharged on that day or the day before, or the day after, sorry. But I was gravely concerned and had said, this is not my dad. You've only met him for a period of 3 days. However, I've known him all my life and this is definitely a different presentation. There's something quite significantly wrong. She said she thought he had capacity and she thought that he was coming across confused because the medical staff were wearing masks due to COVID, and that she didn't think that he could hear her properly. So this was a little bit concerning because I was then questioning, how did he know what you were saying to him? How did he understand what the plan was? How could he make an informed decision if you didn't think that he could understand you? Yet she was still reassuring. I was asking if he needed to have a CT head scan because I was thinking, this is definitely not right. You're telling us his blood sugars is fine. You're telling us his infection markers are okay. There's nothing clinically wrong with him that would be causing this confusion. You didn't think he had a delirium. So there was an unexplained reason for this confusion and this slurring of words and this grunting noises he was making on the phone. However, you put your faith in the medical team and you believe in the nursing staff. I've been a nurse for many years myself and was reassured by that and thought they'll be doing all they can. Surely they're not missing something significant. So that was that. Then the Monday morning, I got a phone call from one of the nursing staff saying, your dad's took a dramatic turn. He's deteriorated quite rapidly this morning. Can you come into the ward? So going into the ward, I went in and what I seen before us, I was absolutely astounded. I could see that he was not far away from dying. There was something significantly wrong. He had no movement in the right side of his body. His face was extremely bright red. He was grabbing at his head, just making awful noises. Anyway, he went down for a CT head scan and the results of that showed he'd had a subdural hematoma with a large bleed, which meant he needed to be blue lighted across to a specialist NHS trust for urgent neurosurgery. He had this urgent neurosurgery, which resulted in him having a craniotomy, which is half of his head removed. He spent a long time in intensive care after that, and he never really recovered to the man that he was. And unfortunately, 7 months later, he did pass away. So this time in itself was very harrowing, but I knew in the back of my head something drastically had gone wrong and I needed to understand what that was. So following this, I made a complaint with the trust where he was a patient and I requested all of his information, all of his documentation, his results, and started off my own investigation where I found significant gaps in documentation, in nursing documentation, in doctor's documentation. Observations weren't entered into charts correctly, which resulted in him having a wrong news score, which then resulted in him having the wrong pathways for treatment and resulted in not having the correct diagnosis, not being referred for treatments in times and some significant delays. So following this, I put in a formal complaint, which was investigated by the trust, met with the medical director, and after the second outcome, finally got the results that I was looking for, and they did admit there was many omissions in care that would have led to changes in his outcome. I think the worst thing that the trust done was to not include me in the investigation. I felt as though I was kind of ignored, and that my opinion didn't kind of matter, or they were determined to investigate it in their own way without any input from myself, which was really didn't make me feel good at all. I think it took a long time for me to get to the place I am now. I feel settled now, and it's been a long journey, but I feel as though the trust, they really did listen. After it took a long time and it was quite challenging, but they really did listen, and lots of improvements have come off the back of this investigation. Obviously feel really, really sad that I lost my father, but I feel some happiness in knowing that we've helped to prevent this from happening again, and we've educated staff along the way. So initially what I wanted was them to recognise that there'd been some omissions in care, and that there'd been lots of omissions in care. And I wanted them to recognise firstly that those make a difference, those little things along the way that would all add up, that they absolutely make a difference in a patient's journey and a patient's pathway. And then I wanted them to recognise that and admit that. And then I wanted them to work with me to make those difference, make those improvements, make that difference, and acknowledge when things go wrong, because in the NHS, everyone's there to do the best, but sometimes things go wrong. And when they do, it's very important that we understand where it's gone wrong and how we can fix that. My expectations would I would have had regular contact with the trust, and that I would have been informed of where they were. If they would have needed any clarity, I would have expected that they would have contacted me to see if there was anything that they wanted me to add, or maybe run by me before I was given an outcome. When I received my outcome letter, it just came through the post. I didn't know it was on its way, and that was really challenging, because I felt as though, although this was my investigation, because it was my father and it was my complaint that I'd made, it had been investigated without me, without the total understanding of what my concerns were, and that I'd just received a letter through the post with infactual information in there that could have been resolved had I have been spoken to before that letter come. Don't be frightened to involve patients and relatives in complaints. It's vitally important that you have most of the answers. Don't look at it as a defensive mechanism when you're investigating complaints. A lot of people who are complaining or have experienced negative situations, they're not there to blame. They're there to, one, understand what's happened to their relatives, understand how they've, what went on while they were in the hospital, and then secondly, to learn from that. And you take comfort in knowing that things have been put in place. So when I first was given an action plan from the trust and telling me what they were going to do, that didn't give me any comfort, because it was just words on paper. What gave me the comfort was being invited in and being shown the differences and being part of making the differences. That was what gave me comfort in knowing that they'd listened and they'd acknowledged and they'd actually physically done something about it. I would just like to add, for members of the public, patients and families and relatives, if you are concerned, then please raise it with trusts. Don't be frightened. If you have a loved one who's still an inpatient and you're concerned with the care and they're still there, and you feel as though you daren't raise that in case they get treated differently when they're in the hospital, then please don't feel like that. You must raise things, because hospitals and care facilities can't make changes and can't make improvements if people don't highlight where things could be going wrong.